Hello class, my name is Brandon Steinwert and this is my presentation on addiction in Butler County, Ohio. This is a very important topic and everybody should be interested in this because chances are you know somebody who this affects. 1 in 10 people will battle addiction in their lifetime. And on the off chance you don't know anybody, it cost American society more than $740 billion in annual lost workplace productivity, healthcare expenses, and crime-related costs. So addiction is affecting everyone in some way, shape, or form. The most common used system for diagnosing substance use disorder is the DSM-5. The Diagnostics and Statistical Manual of Mental Disorders. They define substance use disorder as loss of control over substance use that causes social harms, including neglecting responsibilities, risky use that could cause harm, identifiable physical conditions, and physiological dependence, building a tolerance, and having withdrawal symptoms when not using. The quote on the screen is, "A substance use disorder is understood as a harmful use of drugs or alcohol that leads to serious addiction and impairment of an individual's quality of life." And that is why you have to treat the problem holistically. The biopsychosocial aspects, so biology, psychology, and social. Quote, "Drug addiction burden both society and individuals' life in many aspects, including physical, mental, and social aspects." Substance use disorder can start and continue due to many factors. Drugs that are abused are powerful psychoactive agents that are capable of producing dramatic short-term changes in brain function. Chronic use of these drugs causes a process called neuroadaptation, which is substantial and long-lasting changes in the brain's structure, organization, and function. The biology part of this, some people are born with a predisposition to addiction. As much as half of a person's risk for becoming addicted depends on their genetic makeup. Scientists and people in the addiction field are researching how biology is an important avenue to pursue and search for some new solutions to the addiction crisis. Psychology. The psychology factors can be the cause of the drug abuse, but they can also be a result of the drug abuse. And unresolved trauma is often a problem here. The social factor, well, this is a big part of the equation. In my studies for hopefully trying to become a licensed chemical dependency counselor, they often talk about people, places, and things. That people have to stay away from the people, places, and things that triggers them to want to use. Also, for social, isolation and a lack of belonging are a big deal. And if you have taken any social work classes, you will recognize this chart here. This is Maslow's hierarchy of needs. It is basically 5 levels of what motivates human behavior. It goes from the basic needs at the bottom to more advanced needs at the top. And addiction affects all of these. This chart isn't just for addiction though. These are everybody's needs. But it does really affect addiction. The bottom one, psychological needs, food, sleep, sex, and shelter. Well, it affects people's food for sure. They don't eat enough, don't eat at all. It affects people's sleep. Sometimes people on certain drugs, they will stay up for a week straight to the point where they have hallucinations from a lack of sleep. The sex aspect, I'm not sure about that, but I guess for some people it could help, and for other people it could hurt. I guess depending on the drug too. Shelter, well, you've got people living on the streets, living in the woods. So their physiological needs are definitely not being met. The next one is safety needs. Well, if you're living on the streets or in the woods, I don't think your safety needs are being met either. Security of body, employment, health, and property, all of those are being affected by drug abuse. A sense of belonging, love, affection, family, friendship, and sexual intimacy. Most people, well, I shouldn't say most, a lot of people have burned all the bridges, like their family doesn't talk to them anymore. And the only people that they feel that they have belong with are other people using drugs. Esteem is the next level. Achievement, confidence, position in a group, or status. And if you are addicted to drugs, your status is at the bottom of the ladder. But there is a way to climb out. And self-actualization is the top one, achieving an individual's potential, which is probably impossible to do when you're addicted to drugs. The next slide is charts of the overdose deaths in Butler County on the left and the whole state of Ohio on the right. And I found something interesting here. In 2017, the numbers were really high. In Butler County that year, it was an all-time high. In 2018, it took a dramatic decline. And I was trying to figure out what was going on in 2018 that would have caused this. And that's when I realized that projects like this one were being implemented all over the state of Ohio. The one in Butler County is called Project Dawn, where they educated people about overdoses. They gave free life-saving drug naloxone to families, friends, and any interested participants, and train them on how to administer the drug, which reverses the overdose if caught in time. So let's go back to that slide, to the chart. The numbers dropped dramatically here, and I can believe that from 2017 to 2018, the overdose dropped by more than 100. And I can definitely see that this drug is a miracle drug. But then the following year, 2019 and 2020, the numbers started to rise again. So what was going on in 2019 and 2020? Well, of course, the pandemic, which had an effect on people's psyche for sure. But something else was going on in 2019. Law enforcement and the coroners started finding a lot of fentanyl in the drugs and in the toxicology screens when people had died. Last year, around 85% of drug-related deaths involved fentanyl. And then the one on the right in 2020, that was the all-time high for Ohio. But there is hope. There is a light at the end of the tunnel. So what can we do about the problem? This is from Burlow's TED Talk. Quote, by focusing on spheres of influence that matter the most, you have a better chance of finding simple answers. Addiction, if you focus on the problems right around it, you might be able to find a solution. I really wanted to talk about this next one, but we are running short on time already. So what's being done about the problem? Trying to reduce suffering and death, get people into treatment, and educate our youth. According to the Center for Disease Control and Prevention, preventing overdose deaths and finding treatment options is the first step to recovery. Prevention, education, rehab, and treatment. Medication-assisted treatment, or MAT, is treatment with counseling with drugs like methadone or buprenorphine that are used to alleviate some of the issues with getting clean. But some people don't think you're really clean if you're taking these. Quote, for some treatment programs and clinicians, the barrier may be philosophical belief that medication should not be used to treat addiction despite the overwhelming evidence of efficacy and effectiveness, end quote. It is now medical consensus that addiction is a disease, and this is another quote, compare addiction to type 2 diabetes. Both are chronic, relapsing, remitting diseases with behavioral components. The big thing now with treatment centers is they do what's called integrated care. They try to get their primary care physician, their mental health care, and their substance abuse treatment in one place. All those treatments under one roof, where they give a holistic treatment that targets all aspects of a person's health. There are many different approaches to treatment, and most people are most familiar with the 12-step program, but a lot of treatment centers are going a different routes now. But they're most familiar with this one because of alcoholism. And want to remind you that alcohol is a drug, and if you're addicted to alcohol, it's the same thing as a substance use disorder. Detox, the first few days of getting clean are said to be living hell. Treatment centers can detox patients to make this process as comfortable as possible. After detox, these are the levels of care and treatment. Inpatient rehab is live-in facilities, usually 30 to 45 days is recommended. Outpatient rehab is 1 to 5 days per week, like 2 to 4 hours a day. And they try to, each time they go a week or two without a dirty urine screen, they cut one of these days out. And their goal is to get to 0 days. And then they would go into what's called a relapse prevention program, where they would see their counselors on an as-need basis. And they usually get their medicine, so they see them usually about once a month, but if they need to see them more, they can. And that is my presentation. I'm sorry I had to rush through the end. I just must have been talking slow because it got really long. Sorry.